Ben Durkee. I'm the medical director of proton therapy at University of Wisconsin. One of the things I think is really cool about this conference is, all of our radiotherapy conferences, have thousands of people or tens of thousands of people. But at one point they started just like this with, a couple dozen people. There's 60 registrants at this conference, but you can imagine a scenario where in 5, 10, 15 years, this has grown to many hundreds of people.
It's just a new paradigm for treatment. I think one of the biggest benefits, obviously there's physiological benefits. We know that the lungs expand. We're upright most of the day. That's how we're really active compared to being on our backs. There's some really great work that's been done by Vincent Gregoire and company in France, in Lyon, France. And so they found that patients are reporting that sitting upright is more comfortable for them. It's easier for them to maneuver out of the chair. It's a more humane and comfortable way because the caregivers can be interacting and looking face to face with the patient versus them being in a more vulnerable position on their backs. And so there's been some qualitative evidence saying that it's more comfortable and better for patients. I think we'll see that when we translate it to patient care ourselves. But there's already kind of a signal that it's going to be beneficial from a psychological perspective, a comfort perspective. So we're really excited to see what that might turn into.
I'm Ben Marcusfield with Mevion Medical Systems. We're here at the Upright Consortium meeting with our partners from Leo Cancer Care at AAPM here in Washington, D.C. And it's been an amazing conference so far. So upright treatment really is a big paradigm shift in how patients are treated. So with proton therapy, it really reduces the overall cost and makes it easier to implement. But we heard from a lot of our clinical partners today a lot of the clinical benefits as well, which is really exciting. So I think it's going to improve access for patients to proton therapy treatment, but also a lot of really exciting developments around adaptive proton therapy, both offline and now online adaptive therapy, arc-based treatments, really a lot of exciting shifts. Really just amazing to see a lot of the innovation from leading clinical partners in upright like Stanford and University of Wisconsin. Lots of great work being done, lots of great presentations. And if you didn't make it this year, come see us next.
I'm interested in how upright radiation can help with the treatment of patients with head and neck cancer. That happens to be my specialty. And I think it could help a lot by improving the quality of the plans and by making patients more comfortable with the way they're set up for treatment. For patients with head and neck cancer, their tumors are sometimes blocking their airway, or they've had surgery that make things more difficult as well. And then the addition of the mask and gravity sometimes causes them to feel claustrophobic or have difficulty breathing or swallowing while they're getting their radiation treatment. And I really think by moving them upright, which is the position they would prefer anyways, that it would help with all the above.
It's just back to the future, all radiation therapy started this way. It's very important to realize why did everything go to a position where patients lying down. It's because patients were very sick in the 50s. Patients had to lie down to receive any kind of treatment. But today, 99% of patients walk into the clinic to get radiation therapy, and the only time they lie down in the day is to lie down for the treatment. So you might as well let them stand up or sit up during the treatment. Right, now my passion just is to make sure, and you probably heard my passion, is we need to continue to keep the foot on the pedal, make sure the initiative doesn't die. And if everything was easy, everybody would have done it a long time ago. It's not that easy. We have to push hard to change the paradigm, but we see the future bright and clear, and hopefully we treat patients better and easier and more available to many patients in the very near future.